Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the question paper that is Sri Chitra Tirunal Institute of Medical Science and Technology Staff Nurse 2010 question paper, and this is the part 6 of the question paper discussion. So here I will be discussing the questions from 51 to 60. So this video will be useful for all job aspirants who are preparing for the various competitive examinations. So this examination was conducted on 28/11/2010. So let me start with the discussion of the question paper. That is first question 51. A 35-year-old smoker with gangrene toe most probably suffers from. Options are thromboangiitis obliterans, Raynaud's disease, atherosclerosis, arteriovenous fistula. A 35-year-old smoker with gangrene toe most probably suffers from. So which is the correct answer here? The correct answer is option A, that is thromboangiitis obliterans. Correct answer is option A, that is thromboangiitis obliterans. Then question number 52. Nursing activities shown to potentially increase intracranial pressure include. Nursing activities shown to potentially increase intracranial pressure include. Options are raising the head of the bed to 30 degree, applying therapeutic touch, endotracheal suctioning, speaking softly. So among these options, which nursing activity is increasing the intracranial pressure? That is the question. So here the correct answer is option C, endotracheal suctioning. Option C is the correct answer. That is endotracheal suctioning. There is chance of potentially increasing the intracranial pressure. Then question number 53. The treatment of mitral stenosis is. Options are balloon valvotomy, PTCA, bypass surgery, angiogram. What is the treatment of mitral stenosis? Correct answer is option A, that is balloon valvotomy. The treatment of mitral stenosis is balloon valvotomy. Then question number 54. One of the following is a new test used in acute chest pain. One of the following is a new test used in acute chest pain. Options are SGOT estimation, troponin T or I estimation, blood cholesterol estimation, LDH estimation. So which is the new test used in acute chest pain? In these options, the correct answer is option B, that is troponin T or I estimation. Troponin T or I estimation. Then question number 55. The nurse should expect a patient who has chronic renal failure to be given erythropoietin or apogen to. Options: elevate the WBC count, enhance the maturation of thrombocytes, increase the production of platelets, stimulate the synthesis of red blood cells. So question is, the nurse should expect a patient who has chronic renal failure to be given erythropoietin to. So what is the purpose of giving erythropoietin for a patient with chronic renal failure? Options: elevate the WBC count, enhance the maturation of thrombocytes, increase the production of platelets, then stimulate the synthesis of red blood cells. So correct answer is option D, that is it is to stimulate the production or synthesis of red blood cells. It stimulates the synthesis of red blood cells. Erythropoietin is given for chronic renal failure in order to stimulate the synthesis of red blood cells. Then question number 56. When teaching the caregivers of a patient who has dementia of the Alzheimer's type, a nurse should stress the importance of. Options are increased stimuli, a predictable environment, restricted activities, independent decision making. So when teaching the caregivers of a patient who has dementia of Alzheimer's type, what the nurse should stress? That is whether to increase the stimuli or a predictable environment, restricted activities, independent decision making. So here the correct answer is option B, that is a predictable environment. So the nurse should stress the importance of a predictable environment when caring or when teaching the caregivers of the patient with dementia of Alzheimer's type. Then question number 57. Which of the following blood values on the laboratory report should a nurse expect when assessing a patient who has emphysema? PCO2 52 millimeters of mercury, pH 7.48, then PO2 94 millimeters of mercury, then HCO3 21 milliequivalents per liter. So which of the following blood values on laboratory report should a nurse expect when assessing the patient who has emphysema? So correct answer is option A, that is PCO2 52 millimeters of mercury. So option A is the correct answer. Then question number 58. Which of the following conditions would a nurse recognize as contributing to the development of respiratory acidosis? Which of the following conditions would a nurse recognize as contributing to development of respiratory acidosis? Options are COPD, hyperventilation, diarrhea, achalasia. COPD, hyperventilation, diarrhea, achalasia. So correct answer is COPD. Option A is the correct answer. It will be contributing to the development of respiratory acidosis. So question number 59. Which of the following outcomes observed by the nurse during the drain cycle of peritoneal dialysis should be reported immediately to the physician? Options are clear yellow output, then cloudy output, a patient complaint of slight cramping, a drain output of 50 cc less than instinct. So which observation should be reported immediately to the physician regarding the drain cycle of peritoneal dialysis? So among these options, option B, that is cloudy output, is the correct answer. Cloudy, if there is cloudy output during the drain cycle of peritoneal dialysis, so that should be reported immediately to the physician. Then question number 60. Which of the following foods should be removed from the dietary tray of a patient who has hepatic encephalopathy? Options are idli, drumstick leaves, fresh fruit, eggs. So which among these following foods should be removed from the dietary tray of a patient who has hepatic encephalopathy? So correct answer is option D, that is eggs. Eggs should be removed from the dietary tray of the patient who has hepatic encephalopathy. So here I have included 10 questions. These questions are very important for all job aspirants who are preparing for different competitive examinations. So please watch these videos, all other videos also which I have uploaded regarding this question paper discussion. So thank you.